What's good, YouTube? It's your man CJ checking in once again, aka the High Value Nurse, and I'm back with another video. Pretty good informative video today, and this one is for my brand new LPNs who are going to go into the long-term care facilities. So, this video is how do you properly pick your first long-term care LPN job. Not going to hold you up long. We're about to get straight into it. Number one, you're obviously going to look at the pay rates. Now, my first pay rate as a nurse was like $24.65. So you just want to make sure, and I know it varies depending on what state you're in, but if you're in my area, like the Midwest, I say the average for a brand new nurse today will probably be between $26 and $27. I know that's the median here in Michigan. So you want to look at the pay rate. I mean, look, you just graduated nursing school. You're not going to work at McDonald's. And I say that with all due respect. You know, you expect to get paid, you expect to learn, and you expect for them to pay you like a brand new nurse with a new license. So I don't think it's anything wrong with looking at the market, seeing what the average is, and requesting that. But just do realize that essentially you have zero experience besides clinicals, and they're probably not going to give you 30 something dollars an hour. I don't know, some places they might as a new nurse and long-term care, but most places they probably won't. So I just want to be transparent with that. Second thing, when you go on the interview, well, before you even go on the interview, I would say look at the reviews, but don't follow the reviews. Always go and see a facility for yourself. Around here, we have a group where a bunch of healthcare workers in the area, they talk about the place and they say the good and the bad and everything like that. With some of those, you just got people who hate. Some people are just going to hate on the facility for whatever reason. They may have got DNR. They may have gotten into it with somebody who they didn't care for. It could be a various amount of reasons for why somebody is saying something negative about a facility. And with that being said, you have to take matters into your own hands when it comes to investigating what kind of facility it is. That's why I always say when you apply for a job and you do the interview, you would just, you ask for a tour of the facility. I mean, it's cool to ask people what they thoughts and what their thoughts were, but you always want to ask for a tour. I think that's very important because who wants to work in a place that as soon as you walk in, it smells of urine, feces, and all that kind of stuff. You definitely want to get in a clean facility. And that's a very important thing. Make sure the facility is clean. Make sure they have a good reputation for keeping their linen supplied, keeping their their bath towels, making sure the facility smells good and that it doesn't stink. That's very important because I've been into several facilities that as soon as you walked in, it smelled like Timon and Pumbaa as soon as you walk up in the door. And that's one thing you don't want to work. You don't want to work in that because that says a lot about the facility. That says a lot about the upkeep. That says a lot about people who are in the higher ups, and they keep a facility that is constantly open and it smells like that. To me, that's a big red flag, and you should avoid that at all costs. So, another important thing you want to look out for when you're looking for your first LPN job in long-term care is you want to be aware of what the ratios are. Ratios are very important. Now, when I say ratios, I mean the amount of patients to one nurse. So, typically, I would say in most nursing homes around here, the average patient nurse ratio is like between one, I would say like 1 in 15. I think that's a pretty good average, maybe 16. Um, uh, Probably, I don't know, probably the average would be higher. I think just the particular places that I've been at, but probably I would say, because I want to be real with you, I would say the average would probably be between I would say 1 in 22 patients. The average. You're doing very good if you can get 15 patients, and they all have decent acuity. So, and that's kind of normal, like around here, between like 1 and 2 patients in long term care. And You know, it is what it is. You always want to ask what type of acuity they have. Do they have trachs? Is this do these people take drug addicts? Do these people take homeless people? Because believe it or not, some places do take drug addicts, homeless people. You want to figure out what type of patients that they take to see if it's something that you could personally deal with. I mean, I know a lot of people who don't like dealing with trach tubes. It is what it is. I mean, I feel like as a brand new nurse, you need to learn everything that you can, but some people don't like it, don't want to work with it. So a lot of them have the freedom to try to find a facility without certain things that they don't like. So just try to make sure that the patient ratio is decent. Don't be going in no long-term care facility taking on 35, 40, 50 patients. That's not right. That's not normal. Don't let nobody tell you it should be like that. I know a lot of the times, a lot of facilities are good to try to get you to take 50, 60 patients at night in a skilled nursing facility, not assisted living, because the rules are different. Like, well, and especially according to whatever state you're watching this in. But you just got to be aware and got to be careful of the acuity, the patient ratio. And like I said, they good for trying to put all the patients on you at night because they feel like nothing goes on at night. They feel like nights is easy. The residents are sleeping. Let me tell you something. These residents don't be sleep at night. These residents do not be asleep at night. They be walking around. They be falling. They be doing everything that you can possibly think of. They do at night. And people die on nights. I'm not saying they don't die on the day, but for some reason, it's just something about the nights that make residents that makes them just pass away. It is what it is. So make sure that the patient ratios are decent. Another thing you really, really want to pay attention to. When you're looking for your first job in long-term care as an LPN, you want to ask them, what is the max amount of training that you offer? Orientation. Don't go into a facility offering less than 4 weeks of orientation. I feel like if you are a brand new nurse, you need at least 4 weeks of good training. And a lot of it you do learn as you go, but you need at least a solid full 4 weeks of training. At the place that I got my first job at, it was 6 weeks. But by the third week, they let you, if you catch on and everything like that, they let you go solo. They let you fly on your own. So I would say minimum, try to find you a place with at least 4 weeks of training. If you can get that, I think you're doing pretty well. So those are pretty much the tips I wanted to give you when deciding to go into long-term care when you become a nurse. Now, there's all different things you can do, but most LPNs go into long-term care. That's where the money, that's where the bag is. And I would not recommend going into an easy place your first time around, because I feel like that sets you up for the rest of your career. Not saying that you can't learn how to adapt, but I'm thankful for the job that I had, because it was a bad place. It was such a bad place that it prepared me for other things. You know what I'm saying? And y'all always want to try to continue to learn as much as possible, because the new job that I have orientation at Monday, they have a vent unit. Never worked vents. I'm excited to learn how to do that, work vents, and learn the ins and outs about it. So never stop learning. Always ask about your pay. Let me see. Ask about patient ratios and make sure they have a good program for training new nurses. I know some long-term care facilities love new nurses. They love training new nurses because they can teach them the way that they want to know. So y'all keep that in mind. Y'all just keep that in mind. Just trying to hit y'all with some ism real quick. But I'm about to get up out of here. My name is CJ, aka the High Value Nurse, checking in once again. And I'm going to holler at y'all in a minute. Peace.